Mr. Liang Yinghua.
Question 19, sir.
Mr. Speaker, sir, may I address PQ for oral answer number 19 and 20 in the order paper, and also oral PQs filed by Mr. Leong Man Wai, Associate Professor James Lim, and Ms. Hazel Phua for the sitting on 5th April, please.
Please proceed.
Mr. Liang Yinghua asked if we will review the safe management measures, or SMMs, given that we have passed the peak of the Omicron wave. As the member is aware, the relaxed rules came into effect on 29th March 2022, which is why we are all seated together today. And we have also transitioned to a vaccinated traveller framework on 1st of April 2022. This is a decisive but calibrated move. We did not declare a Freedom Day, nor did we declare the pandemic to be over, as some countries did. Taking a cautious step-by-step approach has served us well throughout the pandemic, and we will continue to do so. That said, we were able to make this decisive move as we observed that the number of daily cases have been steadily declining in recent weeks. More importantly, the number of severe cases needing to be hospitalized has also declined. And it is in this context that the MTF assessed that further easing of our SMMs and resumption of many normal activities to be appropriate. These relaxations will likely cause an uptick in daily cases, which we should be able to ride through without any major changes in our public health posture. Once cases subside further, we will consider further easing of the SMMs. And this can include reviewing distancing rules between tables in F&B settings that Mr. Liang specifically raised. And I want to assure Mr. Liang that I am aware, and in fact the whole MTF is aware, that 1 meter versus 800 cm makes a huge difference to the F&B establishment. It also makes a huge difference in terms of transmission. So we have to weigh the cost and benefit. We will also review Trace Together, Safe Entry, as well as Vaccination Differentiated SMMs, or VDS, which various members asked about. Let me go through the three measures in turn. On Trace Together, and in response to Ms. Hazel Phua and Associate Professor James Lim, MOH no longer rely on Trace Together for contact tracing for the general public. Cases who self-tested positive and go on the Protocol 2 do not upload their Trace Together data, and we rely on them to do the responsible thing, to inform their contacts to self-monitor. So there's really no need to compare the data between self-reporting and Trace Together, because having vaccinated the vast majority of our population and being determined to live with COVID-19, we have passed that stage of the pandemic where we contact trace every case. Having said that, agencies that look after more vulnerable sectors, such as schools or preschools, they continue to use Trace Together for contact tracing. Further, the aggregated statistics generated by Trace Together and Safe Entry can give us a good idea of the settings that are more susceptible to transmission of the COVID-19 virus. So on the whole, the costs and benefits of Trace Together changes as we make further progress in living with COVID-19. The MTF will therefore review its relevance and application to stand it down when it is no longer needed, while maintaining the capability to restart it should we encounter a more dangerous variant of concern. Now for Safe Entry and VDS, I will address them together because they are closely related. Because today, Safe Entry is the most convenient way to check the vaccination status of an individual entering a premise. If we decide to do away with VDS, then there is no need for Safe Entry. As of now, VDS is still needed. Even as we know that the Omicron variant is less severe than Delta, unvaccinated or non-fully vaccinated persons are still a lot more likely to fall very ill if they are infected. As of now, we have about 3.5% of our adult population that are not fully vaccinated, and they account for over 1/5 of cases that require ICU care or die. While the patient load at our public hospitals have eased, hospitals are still very busy. With the recent easing of SMMs and the resumption of visitors to hospitals starting today, workload will go up for our healthcare workers. So the more cautious and correct course of action now is to keep VDS and not to risk having more non-fully vaccinated patients getting infected and needing hospital care and adding workload to our healthcare workers. So make no mistake, individuals who chose not to be vaccinated, they impose a cost, sometimes a significant one, to our hospitals in terms of workload, businesses in operating safe entry checks, and enforcement agencies in conducting checks. When we are sure that the situation in hospitals is stable and improving, we will review the VDS and consider if we can reduce the number of settings or remove it completely. Then it will be a matter of individual responsibility of these non-fully vaccinated individuals to take precautions to avoid high transmission settings, or better still, change your mind and get vaccinated. Finally, Associate Professor James Lim asked if COVID-19 can be treated like influenza at some point as an endemic disease. This is the objective set out by the MTF last year, and we are making good progress as a country. I should clarify, however, what endemicity means. It does not mean that we treat COVID-19 as if it is not there. It is in fact the opposite, because endemicity means the disease is constantly there, circulating at a rate that is more predictable and not likely to disrupt normal lives. Like influenza, which kills tens of thousands of people every year, we will need to continue to take precaution and adopt appropriate SMMs in order to manage the risk and the damage from COVID-19. We are still some way to treating COVID-19 as an endemic disease because the virus is still circulating around the world and evolving. The virus continues to spread widely in other countries, especially amongst those whose people are not well vaccinated, leading to significant evolutionary pressure. There is therefore a risk of it mutating into something more dangerous, into a variant of concern. So while we have eased up the SMMs, reopened our borders, the pandemic crisis is not over. We will have to continue to monitor the local and global situation, do our part to keep our country safe, and continue to work together to tackle whatever challenges that may come our way. Thank you.
Mr. Liang Eng-hua.
Thank you, sir. So in Minister's reply, he mentioned that safe entry is still needed to protect the 3.5% of the eligible population not vaccinated. It's down to 3.5%. So can I ask the Minister from an equity standpoint, does it make sense to inconvenient 96.5% of the population just so that we can deter the 3.5% from the unvaccinated from entering the premises? Does it really make a difference in terms of the public health outcomes? And, or is it just a move to basically disincentivize those unvaccinated from going there, or to get them, to nudge them to get vaccinated? Thank you, sir.
I'll answer the members' questions in a straightforward way. Is it equitable? Actually, not quite. So many of us are doing so much to protect that 3.5%. Yeah. But is it therefore to protect public health outcomes? Answer is yes. As I explained, hospitals are not out of the woods. I just visited Ng Teng Fong General Hospital this morning. They are very busy. We can see cases coming down. We feel generally more safe. We are prepared to gather together without safe distancing, take out our masks when we are outdoors. In the hospitals, it is still a crisis situation. It's very busy. Every day, you have hundreds of people coming to emergency department, many of them with chronic illnesses, some infected, but they don't know about it. But that is the outcome of 2 over years of focusing on COVID-19. The business as usual workload that we call BAU workload has built up. Cases, chronic cases, has become more serious. So hospitals are now busy. Healthcare workers need all our support. So while we understand it's not exactly an equitable situation when you look at businesses, you don't want at this point to add workload to our healthcare workers. So I would say the fair thing to do, we're just coming down the slope of the transmission wave. Let's go through it a bit more. Make sure our hospitals are in a better position. Healthcare workers have a breather. Then I think we consider whether we can remove the VDS.
Mr. Lim Biao Chuan.
So I hate to belabor this point, but really, I know that the doctors, the healthcare workers have been trying to get the unvaccinated people vaccinated, but to no success. So I don't see how the number of vaccinated people will go up. So the question that many people have asked is, when will all this end? So like what Mr. Liang says, all this is at great inconvenience to the malls because they have got to have manpower to man the entry and exit points of their malls. It inconveniences the shoppers who have to go into the malls because now they have less entry and exit points. So surely the Ministry of Health ought to consider the principle of self-responsibility, which is that those who choose to be unvaccinated, they have to take the consequence of their action. I mean, if they choose to do so, despite all our efforts to persuade them, then they have to take responsibility.
Thank you. I agree with Mr. Lim Biao Chuan. At some point, the rules must be more relaxed. VDS will be stepped down. The cost need not be incurred by businesses. And those who choose not to be vaccinated take the responsibility. I'm just saying, so it is in my answer actually, I just do not think it is now because have a care for healthcare workers at this point. They are still very busy. But you are right that the vaccinated number unlikely to go up further. We are at 97%, probably the highest in the world. How to go up further? Maybe go up marginally, but what we can wait for is for cases to go down further. It's for hospital situation to be eased. Then we'll be in a position to review this and make the right decision.
Associate Professor James Lim.
Thank you, Speaker. And if I may just build off the questions that members Liang and Lim have asked, I wonder if the ministry is looking at specific milestones or quantitative triggers that would then bring about further easing and the abolition of measures such as safe entry.
Thank you. The MTF co-chairs have repeatedly been asked, when is the next milestone, when is the next date, when is the next KPI to be reached, and then we will open up further. We have always tried to avoid that approach that many countries took, that when we reach vaccination at X%, let's open up. On this day, let's open up. Because the virus have over and over again proved that it is totally unpredictable. So we really rather not tie our hands that way. But we always look at the entire situation, look into all the unforeseen circumstances, look at the hospital situation, cases, severe cases, vaccination rate, take everything into consideration and make a judgment call. And so far it has served us well. And we tighten up when we have to keep everyone safe, and we also ease up when we can, and letting economic and social activities resume as normally as possible.